Hi, I'm Steve Stevens, and I'm here to talk to you about Medicaid. Now, I'm not a doctor. Heck, I barely made it out of college. Thanks, Dad. But here in the greatest country ever invented, America, I am in charge of Medicaid and making medical decisions. I know, I don't even work for an insurance company, but people like me feel confident that we should be in charge. Now, I've been told that many Americans in the wealthiest country in the world, America, rely on Medicaid to stay alive. Now, I don't know about all that. I'm not in insurance. But I do know money because my family's had it for generations. And we've used that money to cut through red tape and laws to make more money. So I think I know a little something about healthcare. So when I took over Medicaid, the first thing I noticed was that most people on Medicaid didn't have any money. What, the government's gonna pay their bills? I too was shocked. I mean, money that could be used to give to the military to protect our children from being murdered by foreigners. I don't know about you, but I love my children, and I don't want to be murdered by foreigners. Foreigners? This new information has made it necessary to trim the Medicaid budget between 60 and 120%. Now, I realize 120% sounds like a lot, and paying back that extra 20% will be tough on the taxpayers of the greatest country of all time. But it's necessary if you don't want our children murdered by foreigners. Foreigners? Foreigners. How does this affect me, you may be wondering? Well, it doesn't. I don't need Medicaid. I have money. But it might be affecting you if you're part of this bottom 70% of Americans, or sub-Americans. The rest of us will be fine. Plenty of doctors to go around, no more waiting rooms. It's gonna be great. And for those sub-Americans affected by these cuts, don't worry, we're still here for you. We're rolling out a new medical program called DM, Do It Yourself Medical. Easy, no lines to wait in, no doctors. You simply go on Google, and all you gotta do is put in your symptoms and bam! 1,000,000 answers. And no one to tell you what to do. You get to decide. That's great, right? What about medications and medical equipment? Don't worry, we've got you covered. We'll still sell you medication at American prices. And as far as medical equipment, you've got it all over your own home. Ziploc bag, bike pump, needle. You got an IV. Hell, we got a ton of tips for you. And you're welcome, America. And don't forget about that 20% you owe. I'm Steve Stevens, and I'm here for your help.